and I chose anesthesiology for my career of choice. So, an anesthesiologist are medical doctors that specialize in anesthesia care, pain management, and critical care medicine. They have the knowledge to understand when and how to helpfully treat the human body. In the weeks before surgery, an anesthesiologist will make sure that their patient is both fit and well prepared for their surgery. They prepare by asking detailed questions regarding their patient's health, examining them, and reviewing their records. They will answer any and every question that the patient may have, and anesthesiologists create anesthesia plans based on their patients and their records to ensure a safe and proper procedure. Anesthesiologists manage their patients' pain control, anesthesia, and vital body functions during surgery. They can either work alone or with an anesthesia care team. They will monitor and manage medical problems during the procedure, including but not limited to asthma, diabetes, high blood pressure, and heart conditions. An anesthesiologist supervises their medical teams that will care for the patient and monitor their recovery after surgery. They are immediately available if anything were to happen to their patient. The anesthesiologist is the person that monitors how the patient is and when they have fully recovered from the effects of the anesthesia. And they also decide whether the patient should be moved to another room in the hospital or if they can go home. They create a care plan for recovery of their patients and sometimes can even be involved in pain management once they go back home. So the required education, training, and licensing to become an anesthesiologist include 4 years of an undergraduate education, 4 years of a graduate education in medical school, a 4-year anesthesiology residency program, and then residents are eligible to take the ABA exam, which is a two-part exam. The written part of the exam takes approximately 5 hours, and the oral part of the exam varies. They are then required to complete a minimum of 8 years of medical training after college, and many often complete an extra year specializing in a specific region like neuroanesthesia or cardiac anesthesia. Only then, physician anesthesiologists must seek clarification or certification in either critical care medicine, hospice, and palliative medicine or pain medicine. Anesthesiologists work mainly in hospitals and outpatient surgical centers. However, there are other opportunities in private facilities, urgent care centers, and the military. They work long, hectic hours. Some work approximately 60 hours a week. And anesthesiologists work often in teams and are in close proximity to their patients. And the main types of anesthesia that anesthesiologists deal with are general anesthesia, which are used for major operations, monitored anesthesia, which are used for minimally invasive procedures, regional anesthesia, which is often used for childbirth and arm or leg surgeries, and local anesthesia, which is just numbing a small part of the body to remove a skin tab or to get some deep stitches. And they make approximately $360,000 to $490,000 per year. And this is my career of choice because since as long as I can remember, I have always wanted to help people. And in my junior year of high school, I discovered anesthesiology, and I had always been changing my mind, constantly switching between realistic and unrealistic paths. But I stuck with anesthesiology, and I thought that this was interesting and that I could do a long time working in this. And these are my citations.